Good morning, all of you. Uh, Today, I will discuss regarding the delivery in details. Previous class which I have taken regarding the virginity and pregnancy, I think you have studied very well because it's very important for the exam purpose as well as when you will be as final year MBBS student in the gynecology class and obstetrical class, it should be also taught to you. But here you have to know some basic things of pregnancy and delivery. So, what is the meaning of delivery? Delivery means expulsion of product of conception from the uterus at term is very important. Language is at term. Expulsion of product of conception from the uterus at term. So, the language at term is very important. If before term, then there is question of abortion. So, when I will discuss regarding the abortion, then I will say what is the meaning, but delivery means at term there is the expulsion of production of conception from the uterus. Now, in medico legal aspect, what are the signs of recent delivery when the mother is in living condition, like those mothers who are living and has given the birth of the child immediately, or delivery has happened immediately just today or yesterday, then the recent signs, because there are several medico legal issues when a woman pleads or complains that she has delivered the child and claim the property or the money to the court. So, it is the responsibility of a doctor to cross check that whether she has delivered the child, means the delivery signs are present or not. So, the recent signs of delivery in living person, living woman. So, the general appearance, what will be the general appearance if the woman has given the birth of the child immediately or recently, then the woman looks like pale, exhausted and ill. So, general appearance will be the exhausted, ill and pale looking. Next is the breast. So, what will be the signs that is present over the breast, which says or tells us that the mother or the woman has given the birth of the child recently. So, the breast will be enlarged, fully developed, tense and firm. There will be the intense darkening of the areola, means the areola will be more pigmented and wide apart, means surrounding the nipples it also covered and spreaded more widely, and it is well developed as well as more pigmented. Next, the Montgomery's tubercle will be more prominent. I also discussed in the previous class that what is the meaning of Montgomery's tubercle. Montgomery's tubercle, they are much more prominent during pregnancy as well as during the delivery. It is the modified sebaceous glands, they are present surrounding the nipples, means the present over the areola. So, these modified sebaceous glands, they will be more prominent during the delivery also, and there will be the increased venous prominent over the surface of the breast, because there will be increased vascular supply to the ductus and the lactiferous duct basically. So, it is much more prominent, and stria are present over the breast. So, multiple stria, longitudinal stria will be present over the breast, which signifies that there is a recent sign of delivery. Colostrum is very important. The colostrum is yellowish discharge, usually they are secreted from the nipple. They are containing the much more amount of immunoglobulins, phagocytes. So, if it is squeezed, means the breast is pressed, then this yellowish discharge they are coming out for 2 to 3 days after the delivery. Even in the late stage of pregnancy also the colostrum may come out from the nipple. Next, what will be the signs that is present over the abdomen if the mother or the alleged mother has given the birth of the child recently or delivery has happened recently. So, the stria gravidarum, I have already shown the pictures of stria gravidarum. They are the longitudinal stria or transverse stria, pinkish in color, that is present over the abdomen. Linear albicantis, that is the silvery white color that is present over the abdomen also, and linear niagara, already I have told there is the pigmentation that is present over the midlines, usually starting from below the GP sternum to the umbilicus. So, all these signs says that there is pregnancy and deliver the child. Now, what will be the findings of external genitalia? So, external genitalia findings. So, general appearance I have told, then the stria marks which are present, that I have also discussed, then the appearance of the breast I have also discussed. Now, the external genitalia, how you will examine the alleged woman. So, the labia majora and labia minora will be tender, edematous and swollen, will be lacerated. So, the labia minora looks like the lacerated and more tender and swollen, hyperemic and inflamed basically. The porchety is ruptured. I have already told the girls who are virgin, usually the porchety will be intact, but if the mother has given the birth of the child, then due to the stretching the porchety will be ruptured, and due to the repeated sexual intercourse also the porchety will be ruptured and lacerated. Now, the perineum is lacerated because if it is a vaginal delivery, usually the episiotomy is given, and episiotomy when it is given, then the perineum is ruptured, will be stretched. So, this is all the signs of recent delivery. Now, the cervix, what will be the character of the cervix? The cervix will be soft, very much soft, patulous, and transverse laceration will be present over the external os. So, the transverse laceration will be present just around or over the external os. The cervix is soft and patulous. Now, the external os, they are patent and trying to admit the two fingers and lateral one finger with difficulty at the end of a week. So, usually immediate after the delivery, if you want to introduce the two fingers, then the two fingers will be introduced very easily. Now, the vaginal discharge is called the lochia. Very, very important short note is lochia and its medico-legal significance. Lochia is very, very important. So, please prepare for the 4th semester exam as well as for the second professional MBBS, the lochia. So, lochia is nothing but the discharge which is coming out just immediately after the delivery of the child, of the baby or the fetus from the uterus, but these discharge are coming from the vagina. So, it is a uterine discharge, but they are coming through the vagina immediately after the delivery. So, what will be the character and the color of this uterine discharge? Usually, it is offensive smell and it is sour in taste. So, it is sour in taste and offensive or peculiar odor is just like a fishy odor. And first 4 to 5 days, the color of the uterine discharge will be reddish, red color, because of presence of decidual membrane and the red blood clot or RBCs. That is why the shedding of the RBCs or the red blood clots as well as the decidual remnants, that looks like the reddish discharge which are coming out through the vagina. It is called lochia rubra. It is called lochia rubra. Rubra means red. So, the three types of discharge is usually happening. One is called lochia rubra. Next, after 4 days, the color of the discharge will be serous or pale. The color of the fluids discharge will be pale or serous. It is called lochia serosa. And after 9th day, there will be the yellow, greyish or turbid in color of the discharge coming from the vagina. It is called lochia alba. So, the lochia usually is the discharge. They have, according to the days or duration or interval, the color of the discharge is gradually changing. Initially, there will be the reddish discharge, that is called lochia rubra. Then it is called the lochia serosa, means there is serous or pale color of the discharge, and the lochia alba, that is the yellowish or grey and turbid color of the discharge. Now, what are the changes of the uterus? That is very important in case of obstetrics, and it is very important also in medico legal aspect. Usually, just after the delivery, the uterus will be hard, just feeling like a tumor mass, and just like a cricket ball, hard cricket ball, and it is very much contracted. Upper border of this uterus is usually lies approximate 3 centimeter below the umbilicus. So, when you are going to palpate per abdomen externally, you are able to feel that some hard globular structures is situated 3 centimeter below the umbilicus just immediately after the delivery. Next, the size of the uterus is gradually decreasing, and the 1.5 centimeter per day, this size is gradually decreasing. Means, after the delivery the size of the uterus is more, then gradually according to the time the size of the uterus is decreasing. Now, 1.5 centimeter per day, in this rate the uterine size is gradually decreasing, and around 6th day the uterus is present usually in the midway between the umbilicus and the pubis. It is felt midway between umbilicus and the pubis, and around 10 to 14th day it should be present at the level of pelvic brim, and around 6 weeks it becomes the intrapelvic organ, just like a normal woman. So, this process is very important according to the time. If the woman pretend that she has delivered the child immediately, soon we will examine it. If we will examine the uterus, we will see that where is the position of the uterus, and according to the time it is matching or not. And it is called the involution, sub-involution of the uterus after the delivery. Very important thing is the involution of the uterus and the rate of involution. So, it is very important in practical ground. Now, what are the changes in the vagina? The vaginal wall will be relaxed immediately after the delivery, dilated and capacious. Rugosity of the vaginal mucosa is lost or is not prominent. I have also discussed earlier that in virgin girl the vaginal rugosity is much more prominent, pinkish in color, but after the delivery this rugosity of the vaginal mucosa is lost. Now, the biological test. Biological test is very important, that is the human chorionic gonadotrophin hormone. They are secreted from the urine usually. We know that during the pregnancy this HCG hormone is secreted through the urine, but immediately after the delivery, around 2 or 3 days also, this human chorionic gonadotropin hormone is also released. So, if you will test by kit like the Preganews kit or others kit which are available in the market, in that case also the pregnancy test is positive. So, after 2 to 3 weeks after the delivery, this HCG is also present in the blood as well as in the urine also. So, after 4 weeks or after 5 weeks, then this HCG is not present. So, in that situation the pregnancy test will be negative. Now, the very important difference between the parous uterus and the nulliparous uterus. Para and gravity I have discussed. Gravity is the total number of pregnancy and parity means the total number of living issue or viable childbirth. So, if a woman does not give the birth of the child, or there is no living issue, she is nulliparous. And if the woman have given the 2 or 3 children, have given the birth of them, then what will be the character of the uterus? That is very important difference between. So, the parous uterus size will be longer, larger and thicker, approx 10 centimeter into 6.5 centimeter in size. Nulliparous uterus, usually the uterus is small, thin and approximate the size is 7 centimeter into 4.5 centimeter. The weight is usually the parous uterus 80 to 120 gram, in nulliparous uterus the weight is 40 to 60 gram. Next, the body ratio between the cervix and the body of the uterus. The body is twice the length of the cervix in case of parous uterus, but in case of nulliparous uterus, usually the body and the cervical length is the same. Now, the uterine cavity is very important, is the uterine cavity. Now, the woman who is parous means has given the birth of the children, the uterus looks like a wide and rounded cavity and the wall of the uterine cavity is concave from inside. But the nulliparous uterus, the uterus in cavity is small, looks triangular shape and its wall is convex from inside. So, the parous uterus inside the wall is concave because increased cavity is there, that is why the wall is concave, and in nulliparous uterus the cavity is small, so the internal wall is convex. Now, the external os, it shows the oval and irregular and transverse tear and it is patulous. I have already discussed in case of parous uterus, but in nulliparous uterus there is no tear over the external os, it is regular appearance. Internal os, it is not so well defined in case of parous uterus, but internal os is well defined in case of nulliparous uterus. These are the basic differentiating points which helps to differentiate between the nulliparous uterus as well as the parous uterus. Now, the signs of remote delivery in living. If the signs of remote delivery are present, then what will be the signs of remote delivery of a living person, a living woman? So, the external os, external genitalia, the labia majora and minora are relaxed, vaginal rugosity will not be present, so will be lost, porchity is lost and hymen is seen usually the carunculi myrtiformis. What is the meaning of this carunculi myrtiformis? Carunculi myrtiformis is nothing but due to the repeated sexual intercourse, the hymen is ruptured and it is transformed into a pea-sized mass, remnant of this hymenal membrane. This remnant is called the carunculi myrtiformis. So, this carunculi myrtiformis is present after the delivery of the baby also. The os of the nulliparous uterus is well defined, internal os, but the external os is rounded and orifices are closed. In case of multiparous, the internal os is not well defined, external os is transverse irregular. I have already discussed the nulliparous and the parous uterus. So, these are the signs of remote delivery in case of living person, but what are the signs of recent delivery in the dead person? If the mother is died and she has given the birth of the child, then what are the signs which are present which signifies that the woman has given the birth of the child recently? So, all the data which I have told, the what are the signs of the living one, signs of the delivery of the living person, all these signs are present in the dead person also who has given the birth of the child recently. But additional findings will be the uterus and its appendices. The uterus is firm and return to its permanent reduced size. Placenta's size can be identified by its dark color and the coarse granular appearance covered with blood clot, lymphatics as well as the decidua. This is the most important size and signs you have to examine after dissecting the placenta properly. Ovaries and fallopian tubes both are congested. Histopathological, if histopathological examination is done, then the topoblastic cells and chorionic villi are present in the endometrium. One large corpus luteum is present in one ovary. These are the signs of the delivery that is present in a dead person, and all these signs are recent signs. Now, the signs of remote delivery in the dead. The same which are found in a remote delivery in the living person, that signs are present also in the dead person. Additionally, what we will look, additional points are uterus is concave inward, fundus is above the line of the fallopian tube, the length of the body is twice the length of the cervix in multiparous and it is equal to the nulliparous. External os is enlarged, irregular, patulous and admits the tip of the finger. Internal os is not well defined. So, these are the additional findings of the remote delivery in the dead person. Now, what are the medico legal importance of this delivery? That is why we have discussed in this forensic medicine class that what are the medico legal importance of these things. Medico legal importance in relation to the delivery is the abortion. I will discuss in the next classes in details regarding the abortion. So, whether there is abortion or not, we have to clarify. Infanticide is there, concealment of the birth is the legal issues, feigning delivery, that the girl is feigning of the delivery, means pretending delivery, but she is not actually pregnant and has not given the birth of the child. We have to test contested legitimacy, whether the legitimate or illegitimate, divorce is very important, and blackmailing. So, all these are the medico legal implications of this delivery. All these points we will discuss. Now, the legitimacy and paternity. Legitimacy and paternity. Who is called the legitimate child or illegitimate child or bastard child? A legitimacy or legitimate is the state, legal state of a person who is born due to the lawful marriage of his or her parents. Basically, all we have born due to the lawful marriage of our parents. So, all we are legitimate child, but a illegitimate child or the bastard child is one who is born out of parents not legally married, means the father or the mother, they are not legally married, but the child is born. If he is born not within the 280 days after the dissolution of marriage, either by death or husband or divorce. What is the meaning? If a child is born not within the 280 days of dissolution of marriage, means divorce, or the death of the husband may be died and after that the child is born. whether this child is that from that father who is already died, or the husband is born, but there is another sexual relationship with the mother and the another person, means the adultery, and the child is born. So, we do not know whether this child who is born after the death of the husband, whether the child is legitimate or illegitimate. That is a big question. That is why the legitimacy means when a child is born due to the lawful marriage of his or her parents, or if he is born within the 280 days, within the continuation of the marriage of their parents, they are legitimate child. But if he is born not within the 280 days after the dissolution of marriage or divorce or the death of the husband, he is a legitimate child or bastard child. What are the questions where the legitimacy arises? Whether the child is legitimate or illegitimate, why we will busy or why we will look for these things? Yes, it is very important in relation to the inheritance of property. If the child is born and he is illegitimate, then he is not able to inherit the property. But if he is legitimate or the child is legitimate, then he is able to inherit the property. Next is called the fictitious child or supposititious child. Supposititious child means a woman, she pretends that she is pregnant and she has delivered the child, but actually she is not pregnant and she has not also given the birth of the child. Later stage, she has presented one child and claiming that the child is her own child, and in the court she is saying that the child is her own child and she wants to claim the property as well as the money. So, it is called the supposititious child. For the forensic role is there whether really the child is born from that mother. If real or not, then you have to go for the examination, means the recent signs of delivery or not, whether she was pregnant, so the pregnancy signs present or not. If it is a remote delivery, then the remote signs of delivery present or not. So, all these things you have to corroborate basically. That is why we will give the judgment of whether the woman who is pretending that she has given the birth of the child, whether it is true or not. Next, the paternal resemblance means usually the child who is born, usually the character, features, gesture, posture, appearance is look like their parents, because there is genetic transmission. That is why the physical characteristic features, they are transmitted from their parents and look like. If he is not looking like his parents at all, then there is a question whether the child is illegitimate or not. What is the meaning of atavism? Atavism means sometimes the child who is born, he or she does not resembles or does not look like his parents, but some physical characteristics or gesture or posture is transmitted from their grandparents. So, the physical characteristic transmitted from grandparents to the child means from remote ancestor. So, transmission from remote ancestor. Basically, why this is happened? Because you know that there is Mendelian's law and there is genetic mutation. That is why some degrees of characteristic features may be transmitted from remote ancestor also. Now, the paternity test. Paternity test is very important. If the mother is claiming that one person that he is the father of this child, so he claims in the court of law money or property. Whether that alleged father is the real father of this child, how will you test? Then we have to go for blood grouping. whether the blood grouping are matching from the elite father as well as of the child. And the last is the DNA fingerprinting. DNA fingerprint says the exact true whether the elite father is real the father of the child or not. So, the DNA fingerprinting matching which is done from the parent side, means from the father side as well as from the child, and if it is matching, then yes, the elite father is the real father. So, the child is not a bastard child. So, the child is able to inherit the property and the claiming of the woman is true. But if it is not matching, then the claim is vain, it is false. Now, what is the meaning of wife battering? Wife battering means it is a one type of repetitive, severe physical injuries to the woman by the husband. So, repetitive, severe physical injuries attained by the husband. Usually, the husbands are the age of below 40 or 45 years, they are suffering from neurotic disorder, psychosomatic disorder or mental disorder or defect, or the husband is so cruel or he is alcoholic and addicted to the drugs. That is why the repeated physical injuries and severe physical injuries is sustained by the wife by the husband. It is called wife battering. Now, we will discuss the medico legal importance of legitimacy. That is why I have discussed the legitimacy and the paternity. One is the inheritance of property. I have already told, that is why there is a big question of legitimacy or bastard child or not. Nullity of marriage, very important. Nullity of marriage or divorce is the important role with the legitimacy. Affiliation case, I have already told, the woman is pretending that she is pregnant and even after that she has delivered the child and claiming that the property or money from the elite husband in the court of law, whether the child is able to inherit the property or not, that is the affiliation cases. So, all these are the medico legal importance in relation to the legitimacy. Now, its very important thing is the medico legal importance of placenta. Medico legal importance of placenta is very important in case of theory. So, in the previous 2 or 3 MBBS question, second prop MBBS question, the medico legal importance of umbilical cord and medico legal importance of placenta are given. You know the anatomy of the placenta. So, I am not discussing the anatomy, just the medico legal importance I am discussing, and it is also associated with the chapter abortion. When I will discuss the abortion chapter, I will say in details, just remember the 5 points at least and at this moment. So, the medico legal importance of placenta, if the question is given, just you are able to write these 5 points at least. It denotes the duration of pregnancy. The development of the placenta denotes that the duration of pregnancy, very easy thing. Next, the abnormality of the placenta can leads to the spontaneous abortion. When I will discuss what are the causes of the spontaneous abortion, the main important cause is the abnormality that is present over the placenta. That is why there is miscarriage or abortion. Sometimes in case of criminal abortion, the pitches of the placental tissue may be retained within the uterus. In case of terminal abortion, the total product of conception is not coming out. So, the pitch of the or parts of the or remnants of the placental tissue or bits of the placental tissue are present within the uterine cavity. So, there is a question of criminal abortion in relation to the placental placement within the uterus. Next, the placenta previa can lead to the accidental antepartum hemorrhage. APH means antepartum hemorrhage before full term delivery. low lying placenta. Placenta previa means the exact position of the placenta is not there, the placenta is situated in the low lying position of the uterus, not in the usual position, that leads to the accidental hemorrhage and expulsion of the placenta, leads to the abortion before the delivery of the child. Next is the exchange of poison or the bacteria or the antibodies from the mother to the child, which leads to the death. So, these are the medico-legal importance of placenta. This is also related with the abortion chapter. Today's class I have discussed these things up to the placenta. If it is required, I will also discuss in the case of abortion chapter, and the umbilical cord, medico-legal importance of umbilical cord, that I will discuss in the infanticide class. So, this medico-legal importance of placenta and the umbilical cord are very, very, very important in case of theoretical aspects. Thank you.